Researchers from Moorfields Eye Hospital and University College London have identified markers in the blood of patients with glaucoma that can predict whether an individual is likely to continue losing vision despite treatment that aims to lower their intraocular pressure. The paper was recently published in Nature Medicine, and OT spoke with one of the authors to find out more.
I'm Ted Darby-Heath. I'm the Glaucoma UK Professor of Ophthalmology at the UCL Institute of Ophthalmology in Moorfields Eye Hospital.
The authors identified that some patients with glaucoma seem to progress even when the patient's pressure is lowered, and they wanted to identify why.
In this study, we were trying to identify susceptibility factors. Our group and others have looked at mitochondrial function as a potential susceptibility factor. And in this particular study, we were asking the question, how important is a susceptibility factor? Is it? How important is it, for instance, in relation to the level of pressure in the eye?
It's probably worth taking a moment to explain mitochondrial function, as it's not part of optometric practice. Mitochondrial respiratory function is the extent to which mitochondria use oxygen to produce ATP, commonly known as the energy currency of many cells, and it's spent doing things like using muscles. And a fun little fact about this stuff, the average human will synthesize about 50 kilos of this per day.
We measure it in something called a seahorse analyzer, which is an instrument that allows us to plate out cells in a number of wells and add certain chemicals that identify how the mitochondria are functioning and creating the ATP energy.
In the study, they did this by taking a blood test from the patients in a glaucoma clinic who were already being treated with pressure-lowering drops.
We also looked at the association between the mitochondrial respiratory function and the rate of visual field loss. And again, this is in patients who are being treated with intraocular pressure lowering. And we found quite a strong relationship between mitochondrial respiratory function and the rate of visual field loss. The strength of the association was similar to that, not quite as strong, but similar to that of intraocular pressure. That association we measured in a reference cohort of patients from the UK GTS trial, the patients who were on the placebo drops. We also measured another molecule that's related to mitochondrial function called nicotinamide adenine dinucleotide, or NAD for short. And we found that both the NAD levels and the mitochondrial respiratory function was lower in patients with glaucoma compared to age-similar people without glaucoma, and also those who developed glaucoma at a normal intraocular pressure had lower mitochondrial respiratory function than the high-tension glaucoma patients.
NAD is made from vitamin B3 in the diet, and in Western countries, a lot of food is reinforced with niacin B3.
But despite that, there are population studies that have been done in the States and in Korea that have looked at the level of niacin in the diet and the prevalence of glaucoma in the population and found an association. We've applied for funding to do a similar thing in Nigeria, where the foods are not necessarily reinforced, and we'll look to see if there's that same association between glaucoma risk and the niacin in the diet.
Ted warns that this should be thought of as a risk profiling test rather than a diagnostic. He also highlighted some other issues with this method.
The first thing to say is that at the moment we don't have an easy to apply clinical test that will identify low mitochondrial function or low nicotinamide adenine dinucleotide levels in the white blood cells. So if others are able to reproduce these findings, that might be sufficient to encourage people to develop a test that we could apply in clinic. If we get that test, then it would be a matter of identifying which patients come out low on that test and identifying them as being more at risk of faster visual field loss. And the clinical action in that scenario would be to see those patients more often and maybe to drive their intraocular pressure down lower to try and counter the effects of that greater susceptibility. Further down the line, if we can show in the clinical trial that supplementing vitamin B3 enables a replacement of the NAD levels in the blood and improves mitochondrial function and consequently slows the rate of progression, then the blood test would enable us to identify which patients might then benefit from this extra neuroprotective treatment.
TED is running another study titled Naming, which they are actively recruiting for at the moment. They want 500 participants and they currently have over 50.
In the year that we've got less for recruitment, we'd asked patients who've been diagnosed within the last 12 months and who are willing to participate to ask their eye doctor whether or not their particular eye unit is one of the participating centres in the trial.
You can see the participating centres on screen now. So does TED think we should be changing what we tell patients with glaucoma?
I think it's too early to change practice, but it's something to be aware of, because one of the questions almost all patients with glaucoma ask, is there anything I can do in my lifestyle that will either help treat the glaucoma or prevent it from getting worse? It's too early to say whether or not vitamin B supplementation is beneficial, but recommendation for a good healthy diet perhaps has a greater foundation than it did before we published the research.